Governor Beshear announces plans to provide 100% health coverage for black residents. Here's the story from WSAZ News Channel 3. Kentucky Governor Andy Beshear began his press briefing Monday by speaking about efforts he says his administration will be taking to create equality and to start addressing some of the systemic racism that exists in the healthcare system, law enforcement training, and public education system.
My commitment today is we are going to begin an effort to cover 100% of our individuals in our Black and African American communities. But it's time, especially during COVID-19, when we see what happens when you don't have coverage, we're going to make sure that everybody does.
So what's my take on this? Well, on general principle, I'm against discriminating on people based on race. That seems to be un-American. But hear me out. The goal here is to eventually have everyone covered, and I don't believe there's a chance that this will hold up in the courts. I don't know how you can provide health care for some people based on race and not other people. So if they were to give free health care to all black people living in the state, they would have to eventually give it to everyone. And I think universal health care is a good thing. You know, we're the richest country in the world. Every other first world country has figured out a way to give all their citizens basic health care. I think we can do it here as well. I mean, we all know the real reason why we don't have it is because they're making too much money in the current system. But I think moving to universal health care is a good goal. Now, just because a governor says he's going to do something doesn't mean he can actually do it. I mean, does he have to get this passed through the legislature? Does he have the budget to do it? Does he have the authority to do it? Just because you say you're going to do something doesn't mean that it'll happen. I mean, look at Trump. He promised us a big, beautiful wall. There's some wall, but it certainly isn't along the entire border like he said. Just because you're the top person in that state doesn't mean just because you say something that it's going to happen. So I don't know. This is interesting. You know, here in Portland, over the weekend, they had a thing with free COVID testing if you were black. And I thought that was odd, right? How are you going to determine if someone's black or not? I mean, I guess you can look at them, but what about people that are partially black or that may not necessarily look black, but their parents are black? Or maybe, you know, it comes into all these definitions that we don't really have. I mean, are they going to do DNA testing on people to find out if you're black? And how black do you have to be? Do you have to be 20% black, or, you know, is 5% black enough? I don't know. I think this whole thing is complicated, and I don't think that necessarily it's the right way to go about it. But I will say this, we're a big country. If some state wants to try something, see if they can make progress with it, see if they can get anywhere with it, I say go for it, you know. If Kentucky wants to do this, that's great. Now, I don't know how you'd stop people coming in from out of state. I mean, if I were black and I lived in St. Louis or Indianapolis or Columbus or Nashville or something like that nearby, and I needed health care, why wouldn't I just take a trip to Lexington? I'm sure you know somebody that lives in the state. You can get an address, you know, say you're staying on their couch or whatever. So I don't know how you deal with those issues, but that's not my problem to figure out. I think it's great that we have all these different states, and if they want to try different things, go for it. You know, is this the approach that I would take? No. But I don't think it's going to hold up in the courts anyway. There's no way you can provide something for one race of people but not the other. That's just not going to happen. So if they can start this by giving this to black Americans in their state, eventually it'll be for everyone, and I think that's moving in a positive direction. So I wouldn't necessarily be against this. I don't like the way he's going about it, but whatever. Let's experiment. Let's see what happens. New Zealand appears to have completely eradicated the coronavirus, at least for now, after health officials said Monday the last known infected person had recovered. The announcement was greeted with joy around the country and means the nation of 5 million people will be able to be the first to welcome throngs of fans back to sports stadiums, embrace crowded concerts, and remove seating restrictions from flights. It's been 17 days since the last new case was reported, during which time an additional 40,000 people have been tested, bringing the total number tested to about 300,000. Monday marked the first time since late February there's been no active cases. Prime Minister Jacinda Ardern said she was confident New Zealand had halted the spread of the virus, but it still must be prepared for more. Now, why was New Zealand able to do this? Well, for one, their country is in the middle of nowhere, right? So it was much easier, and they closed the borders to New Zealand immediately. If you remember, there was talk about closing the borders to the US, and a lot of people threw a fit that was somehow xenophobic and racist and all those kinds of things. And so the US didn't close its border as quickly as New Zealand did, and so it worked out for New Zealand. Now, this is great news. I would love to travel there, but the border is still closed to New Zealand. You're not allowed to enter the country as of right now, and for good reason. The United States and Russia have agreed on a time and place for nuclear arms negotiations in June, and invited China. U.S. Special Envoy for Arms Control Marshall Billingsley wrote on Twitter on Monday from Reuters, today agreed with the Russian Deputy Foreign Minister Rybakov on time and place for nuclear arms negotiations in June. China also invited. Will China show and negotiate in good faith? I think that this is fantastic news. Often over the past couple of years, anytime there was any negotiation with Russia, we would hear people in the mainstream media bring up how Russia somehow controlled our elections, and this is evidence, right, that Trump is doing what Russia wants, so therefore that's proof that he colluded with them. That was all nonsense. But I think that this is a step in the right direction, that we're having nuclear arms negotiations with Russia. And if they can bring China into the mix, I think that's a positive step toward world peace. Good news for MMA fighters, boxers, and rugby players from around the world. There may now be a cure for your cauliflower ears. The Daily Mail reports, deformed ears are the hallmark of playing contact sports, plaguing ex-boxers, rugby players, and wrestlers due to repetitive, blunt force trauma. Experiments on mice conducted by Chinese scientists found a way to sculpt a new tissue using a 3D bioprinting technique. The study found the method was highly effective and able to create brand new ear-shaped supportive tissue and correct defects. Now, this is good news. I'm sure you've seen people with cauliflower ear, and it'd be nice if they were able to get that without surgery. That would be a real step in the right direction. Although, you got to be cautious. How many times do we hear about studies that worked on mice that don't work on humans? That's the case so often. So I think it's a good step. It's positive news that we're hearing this, but please tell me about it when it works on humans. So that's the news for today, or at least the news that I'm talking about today. Let me know your comments below. Peace.